Hi, good afternoon. This is Dr. Parijat Kumar, the Director of International Sports and Orthopedic Manual Therapy. I hope you enjoyed our today's shoulder assessment and regional interdependence lab. Welcome to our shoulder joint assessment and regional interdependence quiz. I'm here to provide you the answers. I hope you enjoyed it and you scored passing marks on your quiz. So let's start with the answers for today's lab on shoulder assessment quiz. So guys, the first question on the shoulder assessment lab quiz today was, which of the following is a saddle joint? A saddle is like a horse saddle where the movement can be in both the multi-direction. The correct answer to this is your sternoclavicular joint. Yes, your sternoclavicular joint, which is the fourth option, is the correct answer, which is a saddle type of a joint. The second question, which movement happens at the unilateral terminal elevation of the shoulder? So because we were explaining about the regional interdependence as well, so you need to know when you are taking the shoulder into the terminal elevation, you are actually having the side bending of the thoracic spine. Yes, that's the correct option. The second option, it is the thoracic side bending. You also have a bit of a cervical rotation to the same side if in case your levators or your upper traps are tight, but cervical rotation was none of the options. So the correct option was actually thoracic side bending. All right. The third question, what is MCID or the difference for a quick dash score? The correct answer to this was the second option, 9 to 11%, which is the significance in the quick dash functional outcome score for the shoulder. Another question, the next question was, it's a simple one, it's a surface anatomy question. Which thoracic spinous process corresponds to the inferior angle of scapula? So you should be knowing the normal alignment of the scapula, which is from your T2 to T7. So the inferior angle corresponds to the T7, which is the third option over here, and the root of the spine of the scapula corresponds to the T2 thoracic spine. So in this case, third option, the seventh thoracic spine is corresponding to the inferior angle of the scapula. The fifth question, which muscles are shortened in downward rotation of the scapula? You need to know which muscles that you need to work on, release, muscle energy techniques, stretch or strengthen when you are seeing the scapular malpositions in your shoulder pain patients. So for the downward rotation, if this is your scapula, for the downward rotation, if you see the alignment, your medial muscles, which are the rhomboids, and the upper muscle, which is the levator scapulae. So levator scapulae and rhomboids, which is the first option over here, those are in a shortened position, and upper trapezius can be into the lengthened position in the same downward rotation. Next question, the sixth question, this was like a tricky question, and I really enjoy like kind of a doing such types of question, that which muscle is actually hypertrophied in winging of the scapula. You might have come across that yes, serratus anterior is actually weak in winging of the scapula, but which muscle is hypertrophied, is overworking? It is actually subscapularis. That is the second option. Subscapularis is hypertrophied in winging of the scapula. This is one of the very unknown evidence-based fact that many people don't know, that you need to kind of release the subscapularis sometimes when there is a winging of scapula to kind of help calm down the medial border of the scapula. Next question, it was again a kind of a funny question. Which letter actually signifies sign of pain in sick scapula? Sick is a mnemonic where you can remember. S stands for scapular dyskinesia, I for the inferior border, inferior angle prominence, C stands for coracoid pain. So we are asking about the letter of pain. So the correct answer to this is the third option, which is C. C stands for coracoid pain. K stands for kinesis or kinesis dysfunction. So the third option, C option, is the correct answer. Which muscle tear, next question, signifies a positive horn blower? So the scaption, abduction 90 degree, external rotation resistance. So you resist the external rotation, and that actually signifies a teres minor muscle tear. There are researches which shows that you can also include infraspinatus in that, but really it is a primary when you bring it into scaption or a 90 degree abduction and then resisting the external rotation. The teres minor activity has to be the most in this position. So the correct answer is the teres minor tear. The ninth option, guys, which of the following is the age criteria for 100% sensitivity for the Fresno-Quebec decision rules for shoulder radiographs? In order to recommend or order for a doctor to the x-ray after a traumatic incident or a dislocation of the shoulder, what is the 100% sensitive criteria? The correct answer to this is that the person should be above 40 years of age. So the options are like 40 years, 30 years, 50 years, 60 years. The correct answer is 40 years of age. Greater than that, you have 100% sensitivity of this Fresno-Quebec decision making rules in order to order a radiograph for the shoulder. Next question, which of the following scapular dyskinesia is most common in throwing athletes? So the throwing athletes, the most common is when you take it into abduction and external rotation, you need to have that scapular upward rotation in order to perform that. If the person is lacking the scapular upward rotation, then the abduction and the external rotation movement for the throwing athletes would be less, and they are more predisposed to injury. So the correct answer is the first option, scapular upward rotation. All right. Coming to the bonus question. The next two questions are the bonus question. We have that in our quiz so that you keep maintaining your past regional interdependence and the knowledge of what we are taking the labs on. This was like on the pelvis and the sacrum. Again, a tricky question that a therapist is performing a pelvic assessment on a 36-year-old female with a chronic sacral pain. Findings are that the sacral base is deep on the right. Sitting flexion test is positive on the left. Standing flexion positive on the left. What is the diagnosis? I know that the findings are quite less, but you need to be smart here and tell the diagnosis. The correct answer is actually left on right. So the left sacrum is actually moving on the right oblique axis. That is the correct answer, left on right. Last bonus question from our knee virtual lab. What is the direction of the force of the superior tibiofibular joint manipulation in a quadruped position? It's very simple. If the patient is in a quadruped position, you just use your common sense. So if the person is quadruped and you are mobilizing or manipulating the superior tibiofibular joint, you're actually pushing into the anterolateral direction. So antero is like the down and lateral direction. Anterolateral direction, which is the fourth option, that is the correct answer. So guys, good job. You scored the passing marks, and if not, then keep on learning, please. That's why we make this video on the answers for today's lab and the quiz. So keep on learning. Now you have learned shoulder assessment. Now it's time for you to learn the shoulder treatment. Revise these things, practice, read the literature. Then only you will be a better clinician or a student in future to be able to treat your patients better. And shoulder pain is actually very common, be it sports, orthopedic or neuro. You have to see the scapula, you have to see the shoulder, you have to see the ribs, you have to see the thoracic spine and the cervical spine. So there are multiple things that you need to look upon to perform a proper shoulder assessment and then manage and treat it further. So register for our shoulder treatment lab on the next Sunday weekend. The link will be given, the link will be shared in a different group. We welcome your feedback and suggestion. If you have any question and concerns, you can email us at isorehab@gmail.com, and we welcome your suggestions and feedback. This is Dr. Parijat Kumar from International Sports and Orthopedic Manual Therapy. Keep learning. Thank you.